Hi everybody, welcome to my case study on paramedics and self-direct. So just to give a little background, I've been a paramedic for 4 years, which is why I chose this subject. Once any healthcare professional graduates, they need to do some form of self-learning, which is why I chose to do this, because I'm just interested to see the psychological reasons why certain self-learning aspects are good for one profession and not others. And recent advancements has allowed technology to change the way that we are brought up to date on current practices and guidelines. This is an example of one. This is what my current work uses to train paramedics. It's basically a website that we go on. There's a bunch of different modules that you can learn. On this one, you can see stuff from ambulances to scuba diving injuries and everything in between. And that's what they utilize to help train us and keep us. So the employee has the ability to assign mandatory lessons. For example, when Ebola was a hot button issue, we had to watch a video on the signs and symptoms of that. However, most of them are voluntary. That means if a paramedic didn't want to study, they only would have to watch the mandatory lessons, which aren't that common. Before I get into the models of self-directed learning, I just found these questions on one of the YouTube videos that we had to watch for class, and just want you to keep these 3 questions in mind as I'm going through the different learning styles, the characteristics I'm describing of paramedics and why they fit into certain learning styles fit your profession, or would your profession deal with something much better, more formal approach. There are a few reasons why someone would be motivated to do self-directed learning. The first is just to improve your abilities. Paramedics often want to improve ourselves, become more knowledgeable, and therefore be more equipped to treat our patients that we see. The more that we know, the better that we recognize signs and symptoms of certain diseases that are going on in our patients. Related to that is the second one, the fostering transformational learning. Oftentimes you need to reflect on past events, and paramedics often critically reflect on past experiences with patients. Maybe there was a certain patient you weren't happy with how you treated them, or you didn't recognize a certain disease that was happening that you should have, or you thought you should have. You can reflect on that and use that to motivate yourself to learn even more, so in the future you'll be more prepared to deal with that. And then there's to promote emancipatory learning and social actions. Just about 40 years ago, paramedics were based out of funeral homes and driving around hearse, and we've been rapidly growing and attempting to become healthcare professionals, and it's important for us to be able to study up and be able to appear like we know what we're talking about, being professionals. So when we're talking with doctors and nurses, they view us as equals and not some lower level of or healthcare provider. So the first model that I think is most appropriate for paramedics is the interactive model for self-directed learning. On the left you can see just 4 factors that when you have self-directed learning, 2 of them are present. So first of all, you have the opportunities that are found in the environment. So for paramedics, there's generally always an opportunity to study, especially when they're accessible over the internet. Next is the personal characteristics of the learner. For paramedics, we're a fairly self-motivated bunch, and most of us, I find, are type A personalities that like being the best at their subject, so we usually have pretty good motivation. Next are the cognitive process and context of learning. For context of learning, usually that is, well, could be just wanting to know something new, or if you dealt with a patient with a certain disease process that you never heard or had a different presentation that you're used to, then that would be just a reason that you would want to study in cognitive processes. Is just the general thought process that you have going into that. However, these are two more interactive charts. There's not one theory that's right. There's a bunch of different ones. These two were pulled off the internet just from these gentlemen created different theories of or different charts of the same theory. There are two other models for self-directed learning. There's the linear model, which is kind of step-by-step reaching a goal, A, B, C, and then you hit your goal. And then there's the instructional model, which is a more formal, similar to this, because you have some formal aspects to it and some independent aspects to it. No one model is superior. I just believe with the current situation, it's better for paramedics to have that interactive approach and not a linear model. There's too much structure, and lots of times paramedics are studying at work and they have to go out on call, and it's all broken down in that aspect. The same thing with the instructional. There's a couple of times we have formal courses throughout the year, like our advanced cardiac life support, but for the most, it's just studying up on diseases in our spare time. So overall, I'm just having you guys think about what are the characteristics that you think your profession would be for self-directed learners. Is it the same as paramedics? Would you benefit from that type of learning style that I think paramedics would? And then again, are these qualities teachable or innate? A lot of the paramedics are just an innate. They'll want to be the best paramedic as possible, which allows that whole you control your studying a bit more efficient than if it was a teachable thing. Lots of times you would need a teacher to do that. What type of learner succeeds? If you have a lot of paramedics are highly motivated, so they are able to fit in quite well with that type of with the interactive learning, whereas other times in other fields you might have a different type of learner succeeding. Anyways, thanks for paying attention, and here are my references.